Welcome back to Movement Project. Tim Rementor, Doctor of Physical Therapy. Recreational running participation is at an all-time high. Unfortunately, so are running-related injuries. In this video, I'm going to show you 10 moves you have to be able to do before you can get out there and run on the road or the treadmill. The top running-related injuries are shin splints, patellar tendinitis, Achilles tendinitis, IT band pain, patellofemoral pain, plantar fasciitis, sprains, and strains. Test number 1 is hip hike and hip hike with rotations. The risk factor we mentioned already was control of your pelvis in the frontal plane. So how well you can keep your pelvis steady when you're running is a risk factor for injury. The exercise that we need to see you do, the movement we need to see you do, is a fixed limb here, standing still, and then hiking the opposite hip up, holding briefly, and completing 20 repetitions. Now, to fully pass this test, we need this to move in the way it does when you're running, which is a bit of rotation. So what I need to see for a full pass is this hip hikes. You can bring it forward, you can lower it, and you can hike it back up and rotate it back and drop it back down. Now the key is most of the work should be done on this standing side. This is where the burn should be felt. I can just throw this side back and forth, but that doesn't count because when we're running, it's the stance limb, the leg that's in contact with the ground, that's doing the most of the work. Okay, so it's up and over backwards. Okay, that's 2, 3, 4, 5, 6, 7, and take your way all the way to 20 reps on each side. You should feel a good burn. Totally okay if you want to hold loosely for balance with fingertips, but do not hold on with a strong load because of course when you're running you don't have any assistance. The next test is a lateral step down test. We need about a 7 to 8 inch step, so most stairs at home are going to be 7 to 8 inches. And then with your foot dorsiflex, toes pulled up, you need to strike the ground with your heel and then right back up. I need you to do 30 repetitions on each side without a pelvic drop. So I can't see that kind of movement like we were doing in the last exercise. We want to keep this level here. Okay, so it's going to be a good idea for this and a few other movements that you video and make sure that your technique is correct, that this is straight across here when you're doing that, regardless of side. The other big thing with all of these movements is we're looking for symmetry. Can you do the same number of reps with the same quality of movement on each side? If we look at it from the side, we can see we're going down, the knee goes a bit over the toes, heel strikes down, staying nice and level with my shoulders, no drop. Okay, we certainly don't want to see any type of inward movement of that femur, that internal rotation that's a problem and a risk factor for a lot of running injuries. Okay, so 30 reps is our goal there. Some running experts recommend even higher rep counts before you go out to running after an injury. So definitely looking for symmetry and that minimum 30 rep count each side. Now the third test is to address that lack of control and internal rotation. This is a fatal movement for basically all athletic injuries, whether it's a traumatic injury or repetitive type of strain injury. Internal rotation is the main driver of a lot of those issues. So we need to see that in this position, you can use these butt rotator muscles and drive your way through 30 reps. Okay, looking at the side, heels are staying down. We don't want to be on the toes here at all. Okay, and the weight kind of goes to the outside part of my feet. I almost bring the inside up each time and I really feel that burning. So you need to be able to take yourself through 30 reps. Here, the band you use is going to change your resistance. This is a higher level band, but if it's too difficult for you, drop it down and start from there. Number 4, we need to see that you have good closed chain ankle rotation control and dorsiflexion control. So closed chain meaning foot is on the ground as opposed to moving my ankle here with some weight for strength. When I'm running, my ankle's taking most of the load when it's in contact with the ground. So what I want to work on is with this foot flat, can I go in a circular motion clockwise and counterclockwise through that ankle as much as I can. If you need, again, some fingertip stability, go for it. But this is really one of the best pre-run movements you can do, because it does turn on the hip, it does turn on the quad, it does kind of stretch and work your IT band, but it really works the ankle. So I'm looking for 10 total reps, 5 in each direction, and you should feel, we're looking for symmetry here, both in your repetitions and in the size of your circle that you can do. Now my right ankle, as I mentioned in previous videos, I've sprained pretty bad in the past, so I have a little bit more trouble with control. You can see up the chain, I just don't quite have the same level of hip stability, and it all started from this ankle injury, but still can pass the test and ready to get running. Next up is our speed skater reach. This is going to be checking the strength of your hip abductors and your trunk on the stance leg, again in a different way than we did with the hip hike. So I have my tape measure right up against the outside part of my standing foot, and I'm just seeing how far can I reach and tap without putting any weight on this left leg in this case. So I can get over to about 21, 22 inches, and you'll feel that it's a great IT band stretch and help strengthen that. Again, main thing we're looking for here is symmetry. So when I compare that to this side, I can get all the way over to about 26 inches here. As I mentioned in the last test, my right hip is not as strong or stable as my left, and you can see that in the numbers here. So I have a maybe 15% difference right to left. I need to keep working on that, but normative values suggest somewhere in that 55 centimeter range for this reach is standard, but it's going to depend on your height. Obviously, the taller you are, the more you're going to be able to reach. So I still fall in that normal range, if you want to call me normal, but the symmetry is still something we want to work on. Next up is our split squat lunge. Every time we take a step in running, we have separation from one leg to the other, so we need to make sure we have good stability with that split position. I like to take it all the way down, back knee on the ground, and just see if you can hold this position easily for 10 seconds. And then from there, you're going to switch. And again, looking for symmetry. Do you notice a difference in fatigue sensations right to left? Do you notice any difference in your trunk angle? Here, this is another great one to bring your camera into play. So if I have this position and I notice that I shift with my trunk or my hips, when I'm forward, am I leaning forward? When I'm backward, am I leaning backward, to try to capture some strength from one side or the other? Those are all things to try to work on. Again, right to left difference, noticing any type of substitutions that your body's doing naturally. Single leg bridge test is another way that we can try to identify symmetry issues. So on the floor, if you have a bench, you can use a bench. You don't want to be doing this on a soft surface. So I bring this leg extended, I go up as high as I can, switch, check the same, see if there's any difference in height. Now the main thing that we will be looking for with our patients is that pelvis angle. So when I drop, when I lift, I'm straight across with both legs here. When I go one-legged, we want to still see that this is straight and this doesn't drop. And again, is that symmetric right to left? So that we're looking to see, can you control that pelvis position? If you find that one side's weaker than the other, just work yourself through 3 sets of 5, building up to sets of 6, 8, 10 until you find you're a bit more symmetric. Next up is one of my favorite exercises of all time for athletes, especially runners, because it's looking at how well you can control your whole body weight in that closed chain or foot on the floor position. And it's a straight leg deadlift. So we want to, again, try to make sure our pelvis and our trunk are staying flat in a straight line. And I'm trying to see, can I reach down? I have a kettlebell here for a target and to help me balance. As you get more advanced, you can try to pull it up. But we should be, our standard is 10 reps on each side with good quality of movement. Now the quality piece, we need to see a straight line from shoulder to hip to ankle. Even if you need a little fingertip balance, The main errors we see are that or that. So totally straight and extended. Every inch that I go down with my trunk, that back leg should go up the same amount. Okay? We should have symmetry right to left. And as we've already discussed, my right side is not as strong or stable as my left. Okay, and I do get some minor discomfort on my left side when I run because it overworks. Okay, so sometimes your weaker side can be a problem. Sometimes the stronger side can be a problem because it's compensating for the weaker side. Okay? Now, the other main thing we'll see here is a pelvis rotating. So we'll see this cheat a lot of times on the straight leg deadlift where somebody rotates to try to, you can see on my weak side, I kind of do that naturally. So going back, can I keep this pelvis flat like I'm balancing a cup back there? Okay, it's a struggle for me. I tend to want to rotate a bit. Okay, so symmetry there, 10 reps each. Good quality of movement, film yourself. If you pass that test, on to the next one. We can't talk about running related injuries without talking about our push off and our calves. Every program I've ever seen on the internet or in articles talks about strengthening your calves, doing toe raises to try to help with your plantar fasciitis. And while that's important, most runners have strong calves already. The issue is usually in the toe flexors and the ability of the toe flexors, especially your great toe, your big toe, to push off and drive you forward. So what we want to do for this test is get into that split position like we're running, and I need to see that you're driving that big toe down into the ground and you're able to go rock back and push yourself forward, propel forward, 10 reps on each side without difficulty. So getting in that split stance, you can just push forward using your calf, and that's mostly what people are doing when they are doing a heel raise. They're not really using their toes at all, especially their great toe. So the difference with this exercise is you want to feel like you are contracting your toe flexors and you're driving, especially your big toe, down into the ground, almost like an isometric push down. You're trying to push a hole in your shoe and then driving forward onto that lead leg. Okay? Should be able to do 20 reps. Again, we're looking for symmetry here and just digging that big toe down in the ground. If that's a challenge for you and you feel like you need something to work that a little more, or you just can't quite feel it, bring your foot against the wall, and then from there, you put it in a stretched position. So I have a crease in my shoe, and I'm digging that big toe, isometric, driving it into the wall, or the bookcase in this case, and holding that for 5 seconds and relaxing. You can bring your knee forward more, and that's going to put even more strain, and you might even feel some discomfort. If you have discomfort there, then you know that's something that's a part of your problem and you need to keep working it. Next up is another often neglected movement to strengthen and work for runners, and that's rotation. Every step you take, there's some slight rotation of the pelvis and lumbar spine. And we find a ton of times that people have an inability to control rotation in their low back, and that is the main driver for lots of hip problems down the chain. So not only loosening up your low back, but working the muscles that control the spine is so important. So we have our resisted band here, and then we're going to get in our split position like we do with so many other exercises. Front leg bent slightly to lock our pelvis, and then we're just doing small rotation. Okay, I'm trying to keep my spine relatively straight here so that it's stabilizing and blocking that motion. And I'm trying to rotate. I'm picturing a line connecting my sternum to my hands so that they're moving in sync when I go through the rotation. Goal is 20 reps, and then I switch sides. Again, looking for symmetry. The direction that you go is the foot that should be forward. Going left, left foot out. Okay, and we're not looking for some crazy amount of rotation like that, controlled rotation. When you run, you maybe have 5 degrees of rotation happening maximum in your lumbar spine. So just trying to work on controlling that amount of rotation with a gradually increasing load. We want to see you be able to do about 5% of your body weight. This may be a 20-pound band, but the amount that I'm stretching it is pretty limited. So the load is not quite 20 pounds when I do this rotation. Okay, 20 reps each side, looking for symmetry and control. The last thing we're gonna do before we hit the road is see how our landing mechanics are after passing all of our tests. So one jump. And we should be able to see that our hips maintain alignment, our femurs and our knees aren't rotating inward, our pelvis is staying steady, and the same thing should happen on one leg. Did you pass the test? Hopefully so. If not, keep grinding away at those exercises and get yourself back to safe running and more powerful, faster runs than ever before. To help me on my mission to cut out unnecessary surgeries and opiate use, subscribe to my channel by clicking over here. To watch more content about how movement is the driver of all musculoskeletal pain, click down here. Remember, if you want to keep improving, you got to keep it moving.